Hello there, and welcome to Medical Mondays with Dr. O. We come to you live this and every Monday with issues concerning your health and well-being, and we engage you in discussion for informed decision-making about your health, as in our mantra, strong health, strong future. We are streaming live on YouTube and Facebook. Do subscribe to the channel if you haven't, and hit the like button and notification button so you don't miss out on an episode. Tonight, we'll look at the current state of COVID-19. We encourage you to join the discussion by sending your messages during the program to the chat box or raise your hand and you'll be recognized to comment. Our speaker for tonight is one of the leading community healthcare advocates committed to changing lives through healthcare. She is a family practitioner who also treats addiction, HIV specialist, CEO and medical director of Gennesaret Medical Center, co-founder of Global Vision Foundation, and medical director at Global Vision Community Health Center. My pleasure welcoming the renowned medical mission expert, Dr. Toyin Opesanmi. Welcome.
Thank you so much, Honorable Gustav. And welcome everybody to Medical Mondays with Dr. O. I figured we need to revert back to COVID. Thank God. The numbers are going down. Things are getting better, but are we out of the loop? I felt we needed to revisit this because this last week, I got emails from my church that initially 4 people had COVID and the list goes on. My church has practiced physical distancing. Again, as I've said it over and over on this forum, that I believe it is physical distancing and not social distancing, because we are socializing right now, educating one another. And we socialize over Zoom. We've had birthday parties on Zoom and on other medias. And so it is, and that will not cause us to get infected with COVID. But physical distancing, the physical aspect of it can, impact our health negatively if we are not careful. My church also, people wear masks. However, the choir does not. And I wonder, I must say, I attend church more than once a week, but not physically since 2020. I chose not to personally because I feel like I'm a danger to others in the church since I diagnosed COVID and I treat COVID. And I'm a hugger. I can't help but hug. So I felt it was, it's been, safer to do my church services virtually. So as if that wasn't enough, I just came back from Antigua this morning, and we all chose different places to stay in Antigua. I stayed on a resort, but some people stayed in Airbnbs, and these young folks stayed in an Airbnb when they were doing the COVID testing 24 hours before coming back into the US. One of them tested positive and has to be there for 10 days. Mind you, in order to go to Antigua today, you have to be fully vaccinated, at least have 2 vaccines. If you have one, you are not admitted into the country. And, the mask issue, I'll get to that in a minute. So I felt, that's another reason to address this, because we've seen the numbers go down, as I said earlier, and things are relaxing. In our state of Maryland, you can wear masks in some places and not in other places. I went to Giants the other day, and 50% of the people there were wearing masks and 50 were not. So I asked why not, and I was told that it's what you want to do, what you like. I was so excited. I did not realize how inhibited I have felt as a person that I took my mask down and I put it hanging down one of my ears. And I felt this sudden, freedom. I got out of the store and I thought, oh my word, did I really feel like that? I wear masks maybe more than your average person because I wear masks all day in clinic. And except when I get into my car going home that I take it off. So have I been that impacted? I felt we needed to have a dialogue to talk about this, to see how we feel, and to still be mindful about being careful. Are we totally out of the loops when it comes to COVID? Because we've moved beyond COVID-19. We've had Delta variant that, really ravaged people. Then the most latest was Omicron, that was actually devastating all over the world. It was so infectious. And thank God that it was not as much of a killer as others, but it didn't mean that people still did not die. To crown it all, I saw a patient of mine today who told me that I will not mention the name of the assisted living home, but he said that all the old folks on their third floor died of COVID. So it is still an issue. I want all of us, Medical Mondays with Dr. O family, to come every week and to be healthy and not to, contract COVID. And if they do, not to have devastating effect that will, maybe result in fatality in death or in long-term hurling. With COVID, there is a syndrome that we're still dealing with, we're still trying to figure out in medicine, that occurs in some people who contract COVID, whereby they have continued symptoms. And it could be anything. Fatigue is a big one. Brain fog is one that is really scary. And I've seen one of those. And some of them have had it for now 2 years. And we're still trying to figure out what to do with them. So contracting COVID is not a good thing, whichever way we look at it, because nobody knows how one would react or respond to the virus. So, you know me, we know the issue. I like to talk about prevention. So what should we do? In our state of Maryland, there are many places where you don't have to wear your mask anymore. Rules vary from one place to the other. Some people will say when you're inside, you don't, when you're outside, you don't. I don't know, I get confused. You get there and you find out what is needed. I want to encourage personal safety. I would like to encourage us to still keep the mask on just for a little bit longer. And when we wear a mask, I see lots of people wear their mask under their nose. When you do that, you are not wearing the mask. If you're wearing surgical mask, you will see that on one end of it is a string. I've seen many people who would tell me that they didn't even know that was there. So if you don't know, check it out. And on that end is the end that you put right over your nose, and you make it become yours by pressing it against the bridge of your nose to make the mask yours. Then it fits nicely. If you can double mask, it's better. Some people find double masking too tedious. They say they can't breathe. So single mask worn well is better than no mask at all when you are not sure, especially when you go into a place where there are lots of people. I suggest to wear your mask. Even if others are not, we should still protect ourselves. Physical distancing is still an important thing. I don't think we should start engaging in, lots of parties. In our community, we love to party. And I think we should still hold off a little bit more just to see how things roll. So What about the vaccines? Are they protective? Yes, they are. The vaccines may not protect against contracting COVID, but it protects against death, hospitalization, and severe illness. So I hope there'll be questions tonight so we can address the vaccine more and maybe address some of the myths concerning it. Why then, you may want to ask, did a lot of people who have had 2 vaccines, they've had the first one and the second one, why then do they contract Omicron in the numbers that they did, although they survived? There are many possible answers to that question. Some say, in the beginning, that Moderna vaccine covered the virus, Omicron, 33% of the time, which is better than nothing. And that Pfizer was iffy. J&J did not cover it. What we do know, though, is that the effect of the vaccines wane. And there has been new studies from Pfizer that has shown that the effect of the vaccine wanes. And when people get the booster shot, it actually increases their immunity and provides more coverage for Omicron, protects more from Omicron. I've seen someone who got the vaccine and had gotten COVID 4 times. And I've seen people who don't have the vaccine, but they were not sick, or they don't have symptoms, but they keep contracting it. And I see people who have not gotten the vaccine and have been sick over and over again. So getting the virus again is a big possibility. Is it possible that we may have another strain? It is possible. And that is why I feel that we need to be, still careful and vigilant. CDC has approved not just the booster, but number 4. So where are we going with this? Don't quote me on this because this can change. Science moves. Science changes with research. And when it comes to COVID, it's a moving point. It changes. There's still a lot unknown. But every now and then, we'll keep coming back on Medical Mondays, to update you on the state of COVID because things are changing. Where are we going with this? My thought is that COVID vaccine is going to become like the flu vaccine that people would have to take every year. But I'm going to hold my tongue. I'm not going to say too much about that for now. We see how things evolve. I'll repeat, we're still diagnosing COVID. People are still getting hospitalized and people are still dying of COVID. People with weight on them are at risk of getting sicker and dying. People who have underlying medical problems like high blood pressure, diabetes, cancer, and on chemotherapy or radiation therapy, anything that decreases immune system. And guess what? Even smokers are at increased risk of getting severe disease and dying of COVID if they contract COVID. So if you fall into any of this range, please be careful as things are relaxing so that you protect yourself more. if you have any of these things, you fall into any of this category and you've been vaccinated, it's important to know that when somebody's immune system is not that strong, they don't mount a strong immunity as they should or as they could against COVID after getting vaccinated. So getting the vaccine is not automatic, that because you got it, you can get COVID, or you cannot get really sick. If you have anything that compromises your immune system, it is important to know that you still need to be careful on top of that. And I encourage all of us to still take care. So the talk tonight is just a quick burst of the state of COVID. If anyone have any questions, you can jump in at this point and ask the question.
Thank you so much, Dr. O. I already see Dr. Bill. You can shoot the first question, Dr. Bill.
First of all, thank you, Dr. O, for being present, and then you were able to fly out of Antigua. I wish I was there with you, of course, to enjoy the water and the weather. There are 1,000 questions surrounding COVID at this point in time. We who are clinicians have our own questions in terms of the efficacy of the vaccines, which we have been told to recommend, use ourselves, et cetera, et cetera. As a pharmacist, I question the quality that we are putting into it, into what we are preparing these days, whether or not we have adopted an idea of planned obsolescence in our medications that we are now distributing amongst ourselves and to our patients, and or whether or not the commercial reality has entered into the care of medicine at this point. Unfortunately, I agree with you 100%. We have to do something. And when I speak to people and they say, well, no, I don't believe in this. But I said, well, what are you doing? You have to do something. You just can't walk around saying everything is everything. You know, you who has seen it up close and personal, you know, you have your own particular thoughts about it. I agree with you that that COVID vaccine is coming to be like that flu vaccine. Is that because of commercialism? I'll say commercialism, or is it just for the fact that they no longer have to prepare a vaccine that will last us as the vaccine we got when we were infants and children? Is it a commercial venture? Because it is an extraordinary moneymaker. I know it, you know it, we all know it. What do we do? Just say yes, I'm going to get it every year. With the flu vaccine, they have modified the dosing so that now the quaternary vaccine has more mercury. Suppose our patients have an allergy to the mercury. So they keep varying and varying and varying it. What can we say? What can we do as a clinician in terms of people we encounter? You know, we're trying to amass the information ourselves, but what do we do?
You have a lot of questions loaded in there, and I'm going to try, you know, answer all of it. So, is COVID vaccine going to become a yearly thing because of money? The monetary aspect of the vaccine is huge and it's there, but I don't think it's because of money. And I'm going to talk about the flu vaccine, the flu and the flu vaccine, to say why when we give the flu vaccine every year, as opposed to something like you mentioned, other vaccines like for instance, the measles, mumps, and rubella vaccine, or the HIV that we give to children, PCV, polio, all of those too. When we give them to children, I want us to step back and think about it. We start the first shot, hepatitis B vaccine, we give as soon as the baby is born before they leave the hospital. We give number 2 of hepatitis B a month after. We give hepatitis B number 3 6 months after, or a little bit, or somewhere after, 6 months after. Hepatitis A, we give the first shot at 12 to 15 months, and we give the second shot later on that year. MMR that we're talking about, the 2 series too, varicella 2 series, starting at 12 to 15 months. The polio, HIV, the pneumococcal vaccine, the 3, the series, we give 3, 4, 5, depending on the vaccine. So we give multiple vaccines to immunize our children against these diseases. And at one point in time, each one of those diseases have become a problem that killed so many children before we got where we got. So we need to have that foundation first. We enjoying healthy living. Our children are living, life expectancy of children in the US, outmatches most places. You cannot compare it to, most African countries. Children die very early because they are not fully immunized, and, other factors. Now, coming to the flu vaccine, that is given every year because the flu virus mutates. It kills more than coronavirus. We don't know the flu type virus we would have before the fall. So we utilize the kind of flu virus we have in the fall, winter, to start producing the one we will give this year in March of this year, so to say, to make that an example. So the flu vaccine that will be given this year, the process starts in March based on what we had last year. So we have years that the flu vaccine covers the flu variant that we have, and we have years that it doesn't. We don't know what would happen with the flu vaccine until around January. Then we know if the vaccine we had that year is good or it didn't cover well. The same thing with coronavirus. Coronavirus mutates. Like I said, it is a thought, my thought, that it's possible that we may need to get the coronavirus vaccine every year, like we get the flu vaccine. And I've had people ask me the question, why are they forcing this on people? Like I said, we went to Antigua. One of our family members could not make it because they don't have the vaccine. And Antigua, it is a requirement. You have to bring your vaccine card with you. They didn't even require that we test for coronavirus. Like most countries want you to test for coronavirus before you board the plane. Antigua does not require that. So if you travel a lot, you will know that every country has their own requirement, and that's their requirement. So the person who tested positive for COVID that I'm telling you about did get his vaccine. Otherwise, he wouldn't make it into Antigua. But he got coronavirus. He tested positive, when he was testing to come back. So coronavirus, as I want to say, kicked our behinds as clinicians, all of us, it has, because it has behaved very, very unusually in, on many fronts. So I don't think it will be commercialism if it is now required to get coronavirus vaccine every year. Like I said, I was going to say, some people have asked me why this is being forced on people. What they don't know, what most people don't know, and I explain to them because they're not in the healthcare field, is that we in the health professions, physicians, nurses, nurse practitioners, physician assistants, radiologists, anything you do in the hospital, it was mandated that we got the influenza, flu virus every year. All the doctors on this forum, all the healthcare professionals on this forum would attest to that. That has been going on since I've been in this country. So asking people to get a vaccine in order to prevent this disease is not something new. So I don't think it is commercializing or it is all monetary based. We've seen that the vaccine has been effective in curbing coronavirus. If you are fully vaccinated today and you contract COVID, you're not going to be as sick as you could have been. You may even have no symptoms at all, and you most likely will not end up in the hospital, let alone die from it. So we've seen that it is effective, and people need to understand that there's a difference between the vaccine being effective and not getting the virus at all. You may still contract it. And that's where, people get a little bit confused that I thought they said it works. So why did I get the virus? They're two different things. And sometimes it does protect you from getting the virus, depending on your level of immunity. Everything I've seen that I've read says that there's no good way that we can tell yet that you are, protected against the virus after you get COVID or after you get the vaccine. I'll tell you my experience. I test for antibodies in my setting, COVID antibodies. So after you get the virus, just in my setting, just because I want to know, there's still so much unknown. And I hate groping in the dark. I like to know what is going on. So I check the antibodies of my patients who have contracted COVID, and the ones who decide and agree to go get vaccinated afterwards, I check the antibodies again to see how they're doing. And this is what I've seen. People mount antibodies against COVID after infection. I have not seen any of those that have antibodies greater than 2,500, which is the highest level of immunity you can have in the testing we have right now. But after getting the vaccine, maybe the first or the second, they get to that point where their antibody level is greater than 2,500. So I can see why it is, so it is encouraged for people to still go and get vaccinated after they've gotten the virus. They don't mount enough antibodies, natural antibodies, after contracting the virus. Did I answer your question somehow, some way?
Yes, you did. You crossed the board completely. Thank you, Dr. O. I agree with you. I've been suggesting those who have actually come down with COVID to, in addition to that, employ some level of a protocol that we discussed early on prior. And so they're doing they have antibodies, and they're also doing a protocol just to ensure that they stay to some degree healthy. There is another question, does or will the antibodies wane over a period of time. And I believe you've spoken to that. So, which necessitates the ongoing and continuation of being boosted again and again. So thank you. Thank you very much.
Thank you so much. Dr. Bill, I like, that statement at the end. I have tested people who are fully vaccinated, and they had antibodies greater than 2,500. Some of them had had COVID before they got vaccinated. They have that. And I've tested again and see their antibodies wane, decrease. So with time, the antibodies is decreasing, but that is consistent with coronavirus. When we had MERS, and we have the SARS. When we had both, we saw that we didn't have vaccine then because they were endemic to the Asian countries. Coronavirus was not a pandemic then. So there were no vaccines. We saw that people developed antibodies, and the antibodies waned after 1 to 3 years, depending on the person. Some people still had the antibodies for, a year, you wait, and, it goes away, 2 years, 3 years. So it is consistent with what we have known about coronavirus, because it's a virus that has been around for God knows, I don't know, 100 years, yes. I don't know.
Yes, long time, yeah.
A long time.
Long time.
It just became a problem, is why, we had to deal with it.
Sure, sure.
Thank you, Dr. O. So just as you said, the effect of the vaccine wanes over time. Initially, we're getting the shot, now double jab, you get a booster. And I'm hearing that even those above or 64 and above still need another shot. So with all this, if the vaccine is not, let me put in a bracket, that effective for those who hold a view that they don't have to get the vaccine, how do we convince them that it is important with all this?
Well, okay. It's one of the reasons we're having this. I think education is how we convince them. And some people may not be in the health field or scientific field, but they have scientific minds. They want to see, they want to know, and they will believe. I have seen, like I said, some of my patients who did not want to get the vaccine, and because they got COVID. So I said, you know what? Let's test your antibodies and see how well you've done. You have the reference range, and they can see in the reference range that you have antibodies up to greater than 2,500, right? So I show it to them that you got COVID, but guess what? Your antibodies is in the 149 range, 149, 179. That's what I usually see. And can you imagine? You can build up that antibodies to greater than 2,500. It's a no-brainer. And that does it for some people. Another thing is to let people see that people who are not vaccinated are the ones who are most likely to die after getting the virus, or to be deathly sick, or to have that long haul syndrome. Look, you can say, look, it's just a virus. I don't mind getting it. I'm going to get well. What if you end up being one of the long haulers? We now have a brain fog. There's a doctor who got COVID in 2020 and has not been able to go back to work yet from brain fog. The doctor did not choose not to get vaccine. We didn't have vaccine then. We had nothing to help them. What about lingering cough? What about fatigue? That people cannot go back to work because they fatigue. So Once we educate people, hopefully they'll get it, and to let them know also, the vaccine has no metals, it has no GMOs, it has no, look, it doesn't have mercury, it doesn't even have egg. The problem with flu vaccine for a lot of people is egg allergy. If you have egg allergy, we recommend that you don't get the flu vaccine because it has that egg component in it. This vaccine does not have anything. It's a state-of-the-art technology. It's an mRNA vaccine. It's clean. And you know what? Refer them to Google and to Google the components of the vaccine. And let them see that it doesn't have, what do they call in that phone? 5G. It doesn't have anything to monitor you. Because guess what? You've been monitored anyway. What happens when you're having a dialogue with somebody and you're talking about pizza? I like spinach pizza, you like, pepperoni pizza, and the next thing you pick up your phone and there's an ad on where to get the best pizza in your area. What happened? So there's no tracker, and it's not the mark of the beast. Because some in the church would tell you that this is the mark of the beast. No, it isn't. So I think education is what can help us to educate others and to help them. Because we want people to stay alive and we want people to be healthy. I just saw, I was private chatted that someone on our forum here actually caught COVID for the first time, testing positive on Tuesday. And they have a lingering cough, which does not, and they want to know what this means for them. This person is currently on benzonatate. Benzonatate is Tessalon pearls. It's a gel-like cough medication. It's excellent. I prescribe it all the time for somebody who has the COVID cough, and it works great. This person in our audience actually got vaccinated, got Pfizer vaccine. And they say they thought COVID numbers were down. This is why we're having this talk tonight. Like I said earlier, we believe COVID numbers are down. I know they're down, but they still are there. COVID is still very much amongst us. We still need to be careful. And for our family member here, who are Medical Monday's family member, who got COVID, you're going to fare well. It's just Tuesday. And cough is one of the symptoms that is common for COVID. If you think about the common cold, virus infections, normally cough is usually the last thing to go when you have them. So with COVID, cough is usually also the last thing to go. Tessalon pearls benzonatate is a good choice to treat it. You're going to be fine. Thank God you were vaccinated. And so I'm glad you vaccinated. Give it a few more days and the symptoms should clear.
Thank you so much, Dr. O. There's a comment from Dr. Marsha. She says, I am concerned about the number of breakthrough cases in people with no known underlying conditions. I am aware of one death of a relatively young man who was vaccinated and boosted. This I found very unsettling.
Yes, it is. COVID is nasty. And it's a young man, yes. But trust me, we don't know what kind of underlying medical problem this man has. But forget the underlying medical problem. Don't let's even bother. Maybe he doesn't even have any. He got vaccinated and boosted. Welcome to my club, because I've seen many who were vaccinated and boosted and got Omicron. And I know one person that was very sick and was sick for weeks before they cleared the virus. But let me tell you, they would have been sicker if they didn't have the booster or they didn't have the vaccine at all. It would have been worse. This young man died, got vaccinated and boosted. In my opinion, he's done his best. In his case, the best was not good enough. I challenge everybody on this forum to do their best. Once we've done our best and we've put our best foot forward, then all we can do, even before we do that, is to trust the Lord to keep us safe. But let's do the needful. What we have, what is the best thing we have to protect us against COVID's death and COVID's very sick syndrome is still the vaccine. So I encourage all of us to get vaccinated. And if after this talk tonight, you still have an issue, please private chat me with your information so we can dialogue further, or email me, and you got my time. Auntie Tower, you have your hand raised.
Good evening, Dr. O. Good evening, everyone. I have a brother. He has more than 50 years experience as a medical doctor. Until now, he refused to get the vaccine. How do you convince that kind of person? Is my biological brother, same mom, same dad, and he totally refused. And he wants to come to my party. And I said, if you're coming, you don't come to my house. And he got upset.
Ooh. So, how do you convince him? Evidence. He's a scientist.
Yeah, he knows.
Physician. Evidence. Oh, don't assume.
He tells you all kind of stuff. He will tell you all the documents. He will tell you, I mean.
Education. Evidence. It's all we can give. And if that's not good enough, then we keep praying. We keep praying for such a person. But the evidences are there that it's okay to get the vaccine.
Thank you so much. It's always difficult when family comes into play, and you can't get close to a family member because of their stance on the vaccine. A question from...
Thank you. Just a minute before you read that question. Thank you for raising that point. He may not listen to you, Auntie Tower, because it's you. It's family. A prophet does not have, what did they say? Respect amongst their own, correct? It's a popular saying. You may need to hear it from someone else, and you can make that happen for him. Maybe you can hear it another way and understand it better.
Thank you.
Thank you, Dr. O. From Richard Williams, how do you treat the lingering symptoms of the long haulers after contracting COVID-19 twice, although now fully vaccinated and with 2 booster shots, but the symptom persists?
Ouch, is what I say. Attorney Williams, sir, it's one of the reasons we're advocating the vaccine, because we know that when people get vaccinated, most, you know what, I've been saying things generally, is most, I should be saying. Most people, if they contract the virus, would not get the long hauler syndrome, they would not be as sick, or they may not have symptoms. But now, this person already have the symptoms, the long haul symptoms. Now, it's after that they now fully vaccinated, we're still working on how to tackle long haulers. We're praying and hoping that we will have a breakthrough to know how to deal with those symptoms. We've never seen that with any virus. COVID is a beast. So we'll keep that person in our prayers and tell them, please, sir, to stay tuned for, better information, and hopefully in the very near future, how to take care of those symptoms.
Thank you.
Thank you, Dr. O. This one from Dr. Abijah. I say, thanks, Dr. O, for the update. I have a question after this preamble. U.S. Senator Tim Kaine is all too familiar with the harrowing effect of long COVID. And no one of the Wednesdays, okay. The Virginia Senator introduced legislature to help other Americans struggling with the same mysterious illness. Kaine was diagnosed with COVID-19 nearly 2 years ago, but still suffers from moderate symptoms. And he is not alone. Thousands, potentially millions of Americans have continued to cope with health concerns long after infection. Because more research is needed and diagnoses remain inconsistent, it's hard to gauge just how many people are plagued by lingering effects of this virus. Dr. O, your thoughts on the lingering effects of this virus?
Wow. My thoughts are that by the grace of God, research will lead to how we can handle it. We don't know just yet. We treat it. How do you treat brain fog after COVID-19 infection that doesn't resolve? I was talking to a 22-year-old girl who had the long haul, the brain fog. And while we were talking, I was giving her instructions on, okay, this was on the phone, not even my patient yet. She was referred to me because the family was just beside themselves. They didn't know what to do. So I was giving her simple instructions on, okay, I'd like to see you, we can, in seconds, she's forgotten what I said. We didn't have 5-minute conversation. First, like, I have to get off the phone. My head. I didn't know what to do. Again, I want to talk about the fatigue. I've seen a lot of in the long haulers. We just have fatigue. And this fatigue is so bad, they can't do anything. They can't go back to work. My thoughts, we need to continue researching. We need to, continue trying different modalities and see what would help. And I'm hopeful that we will find a solution. But right now, we don't have one yet.
Thank you very much, Dr. O. A question from Wendy. What if you have been vaccinated, then you have COVID? Should one get the booster?
Absolutely. Please, if you have COVID already, go and get the booster. If you have COVID already, you haven't been vaccinated, get vaccinated. You should get vaccinated after infection. Dr. Buka, I see your hand off.
Unmute. Okay. Yeah, sorry. Okay, as you said, we have always had to have vaccines throughout working as physicians. I've had to have hepatitis B and the flu vaccine every year. Secondly, I have given up convincing people to go and get the vaccine. I have a sister-in-law who has multiple myeloma and refused to get the vaccine at that point. And her son, who works in the IT in the hospital, because he's working from home, he says, oh, this, that. And you know what I did? Is my nephew. I stopped calling him. I don't call him for his birthday. And I don't say anything else to them except if I see them. And I don't say anything to her about the vaccine because she goes very silent. But you know, this coronavirus is a new virus. We're still finding out. Last Saturday, I had my second booster. And man, that second booster really had me lying in bed, worse than the previous ones. I was surprised. But somebody was telling me that a colleague of ours who is diabetic and whose wife is not. But when the coronavirus came to the house, she was so sick, she almost had to be admitted. And he, being diabetic, thought he would get it worse, but he didn't. So we don't know how it attacks people. It reacts in many different ways. So the virus is still, and as far as I'm concerned, the virus is still around. But there's something I did from, there was something came out on my WhatsApp from Ghana, and they said it's like a pour sauna. Just inhale hot water, just the steam. Not too hot to burn your nose, but enough to your mouth. And I tell you, my husband does it 5 times a day. I maybe do it once a day. But we have, thank God, never had coronavirus. And I think that's, and you know what? My daughter came to the house a couple of weeks ago, sniffling, saying it's allergies. Oh, I tested negative. But she said, wear your mask, and we both wear masks. The next day, she was positive. And up to now, thank God, I'm not. I got tested, a PCR, and I'm not. So this coronavirus, we don't know what to expect. All we have to do is to run away from it as much as we can. Wear your mask. I don't care. I'm going to Florida. I'm going to wear my mask. I don't care who, unless they charge me, then I'll just take a plane back. But we just cannot, we don't know where it is. And this Omicron, it's so contagious. So we just have to be very careful. And like I agree with you, continue with the mask. Thank you.
Thank you, Dr. Buka. Thank you so much for that contribution. And I'm so glad that's a fellow physician. But the couple, Dr. Buka, you said the husband got vaccinated, but the wife didn't?
I think they were both vaccinated, but she got it worse. And he's diabetic.
Guess what?
Poorly controlled.
Guess
and
what?
he didn't get, yeah.
Is she big?
I don't know.
Okay.
But I know I'm diabetic, so I don't joke with corona.
Well, you have to look at confounding factors. If she has weight on her, that's a reason why she would be sick. There are other things she may have. She may not have diabetes, but her immune system may not be strong. So, and because I treat this, I see this, and I know people's underlying issues, I've seen this a lot. Then steaming. What you're talking about steaming, my husband is an ER physician and he does it every day. He vouched by it. Oh my gosh, but we did this back home. They even put things like mentholatum or something like that in it, and you cover your head, you let the steam you. It's believed that, it kills the viruses. Look, I need research. For me, I need research to tell me that it's okay, but there's no harm done. Please, if you want to do that inhalation, do it every day. It doesn't take anything away from you, but get vaccinated. Did you see? Right in your home, COVID came to visit. And that is why we still need to protect ourselves. I went to Antigua. I didn't wear a mask. So you know that I'm protecting everybody from me because nobody was wearing masks. And I don't know. We should wear masks. We should still protect ourselves. Don't be like me in Antigua. Madam VP, ma, welcome. Please unmute. And happy birthday. It was her birthday yesterday, and I was
yes, happy birthday. Thank you, ma'am.
You
May
shall
God bless
celebrate many
you.
more, ma, in excellent
Amen.
health, without
Amen.
COVID.
Amen. For all of us. For all of us. Yeah, Doctor, welcome back. And I just want to add to your recommendation that, people, we need more research and people need to just be educated more. For the lady whose blood brother is not convinced, I'm going to ask you, ma'am, to please continue to talk to him with compassion. See, when it comes to decision making, people want to know that they're in control. When we shove it down their throats, you're just giving them the option not to. This COVID thing is almost becoming like religion. There are many people who don't believe there is a God, and you have to be convincing them. But if you're looking for research, there is a 46-year-old district attorney in California who was fighting Biden. That Biden and the governor Newsom in particular had no right to mandate people to wear masks. He fought that hard. Unfortunately, she caught COVID. Very brilliant, beautiful woman. She caught COVID and died. It wasn't even the fact that she doesn't believe that the vaccine works or not. She was just saying the governor had no right to mandate people to wear masks. Can you imagine that? It's the same thing for people who don't believe there's no God. You will get to heaven to find out that really there is God. Those who don't believe in this vaccine until they die, but it's too late. But for our loved ones, we don't wish that for them. Sorry, crazy person driving around here. For our loved ones, we don't wish that for them because, it would be too late. So we need to convince them, talk to them with compassion. Let's not get angry. Just continue to convince them. Let him realize what he's missing out in not being able to come to your house, what he's missing and not being able to connect with his nieces and nephews. And if those people mean anything to him, for their sake, he should consider the vaccine. We need to continue because I for myself, I didn't get the vaccine because I'm smarter. I just made the choice that if this is going to save me and my children from sudden death, then that's what we're going to do. Like Dr. Ho said, we don't know what the lingering effect will be. We don't know what else is out there. But hey, hopefully they will continue. The scientists, God will bless them with wisdom to continue to support us with more. Sorry I took too much time, Dr. O, but I just don't want us to stigmatize those who are not getting the vaccine. We need to encourage them. Thank you.
Thank you, ma. You're good. You didn't take too much time. That was well-needed words of advice. Education is important. And yes, thank you so much for that input. We need to do it in love and with kindness. Another thing is we need to find out why people don't want to get the vaccine. When we know the why, then we can know how to address the fears it could be, or myths, or whatever it could be. So knowing the why is important. Like I said, Auntie Tower, you know how to connect. Okay?
Dr. O, I
Yes,
did it with love. I did it for the longest time. We keep on talking. He will send this chat to me. See this, see that, see. So it's just not convinced. And even his children are all doctors. They are here in California. They talked to him, he refused. So I don't know how much.
Like I said, you know how to connect him. He'll get it. So we'll get it done. But we would continue to do it in love and continue the education. COVID is still very much here.
Thank you.
Yes, ma'am. Thank you, ma'am.
Thank you. There's a question from Remy. What's the difference between Omicron and regular COVID-19?
Excellent question. COVID-19 was the coronavirus that we first recognized that devastated the world, the one that came from Wuhan, China. Because it started, or they recognized it, because we really won't know when it really started. Because it was first recognized in 2019 is why it's COVID-19. It's coronavirus 19, COVID for short, and 19. Omicron is a variant, it's a mutation. The virus keeps mutating like viruses do. That's what they do, they mutate. HIV virus, flu virus, name it. They have the potential to mutate. And coronavirus kept mutating, and we had, different strains. One of the strains, the last of the strains that we've had so far is Omicron. So did I answer your question?
I should think so.
Okay.
Are we live on YouTube? Remember to subscribe and hit the like button. Also hit the notification button so you don't miss out on any episode. Whenever we are live, you will be prompted. Comment from Dr. and Dr. Ajay: education is much needed to clear all the confusion. And then Dr. Abija says the multi-million word is do your best. So we keep doing our best, getting the education, raising awareness that COVID is still here, or whatever mutation or whatever variant is still here. So we have to do our best. And that takes us to our Medical Monday moment.
Fantastic. Thank you so much. I'm going to share. American Airlines, Medical Monday's moment. I always see something positive. This has a positive twist too. But American Airlines, in the history of them and me, and anyone that I know that takes that airline, they always have delays, cancellation. It's a pain in the behind. And if I don't have to take them, I really won't anymore. I don't know any other airline like that. My experience coming back from Antigua was, oh my gosh. There was some delay leaving. We got to Miami and we were in the plane for an hour. Many missed their connecting flights before we even disembarked. And then when we disembarked, we had to go through immigration and get our bags. And we had less than an hour to get to the plane, and then to go get rescreened, go through TS. Thank God for pre-check, TSA pre-check, and whatever we all had to get us through it. But it was an experience. But thank God we made it here. Got home after 1 a.m., but still got home. So I just want to praise God for all of us, for what God does for us that we take for granted sometimes. I sit down here and complaining about, the delays, the sitting down and all. Well, what about Johnny Mercies? Every single one of us on this forum, or maybe I keep saying I should stop this generalization. Most of us on this forum have been in cars today. I've driven from point A to point B. Some have been on planes, and we're here. So it is reason for us to praise God that God keeps protecting us. And so till next week, I want to encourage us to keep safe, to not take for granted that because mask is coming down, or they are coming down in various areas around us, that COVID is history. Not quite yet. I want to encourage us to still be a little bit more patient, and please go get your booster. I'm going to get mine. I was very ill after my second one, but I'm going to get the third one. Keep me in your prayers. I'll keep you in mind. Go get your booster and let's stay tuned. We will keep updating you every now and then on the state of COVID. It may not be me, It may be another speaker, but somebody will be here to update us on the state of COVID. Next week, we're going to continue a discussion from last week. We are working hard to fulfill your requests for next week. You requested that we continue a discussion on depression, suicide, and Auntie Tawa, are you saying something? I want to see.
I said mental health.
Oh, wow. She remembered. We are listening, we're learning. Thank you, ma'am.
You're welcome.
We are going to continue next week as you popularly requested. We were advised here on the forum last week that we need to break down the topics because there's a lot in what we bundled in last week. So we've devised a way to bring you the best of the best. And the forum next week will be a little bit different to give you more, to give us more. So we'll be back with that. And, we just decided to plug in the state of COVID because we're scared at all this, at all the blips we're seeing of people still contracting COVID. So see you next week. Honorable Gustav.
Thank you so much, Dr. Toyin Opesanmi. Today gave us an update on the current state of COVID-19. She is CEO and Medical Director of Gennesaret Medical Center, co-founder of Global Vision Foundation, a nonprofit 501c3 organization, and Medical Director of Global Vision Community Health Center. Thanks so much for joining. We are so pleased that you join us, and don't forget to hit the like button on your way out, hit the notification button, and then you will not miss out on any of the episodes of Medical Mondays. And that concludes another exciting conversation about your health. And we're looking forward to meeting you